Hi everyone. My name is Mohamed Almahal. I'm the Director of Humanitarian Relief at the Sudanese American Medical Association. Thank you, Mr. Peter Hogness, for inviting me into this video to give an overview of our efforts in Sudan since the war started on April 15. The Forgotten War, I'd like to name it as this because this term, Forgotten War, addresses how global attention have been dealing with the Sudan war. So Sudan get limited media coverage, limited global attention, and limited international action since it's broke out. And I just wanted to say that we are still here. SAMA and other humanitarian organizations and regional actors still persist to address challenges in Sudan. So Sudan war broke out on April 15th between the Sudanese armed forces and the rapid support forces. And the situation since the war broke out has been disastrous to people in Sudan. So 6 million have been displaced inside and outside Sudan. And according to the UN, Sudan became the largest country with displaced people. And more than 12,000 have been killed during this accident. So a word about SAMA. SAMA is Sudanese American Medical Association. SAMA is a 501c organization established in 2008, and we had offices in Sudan since 2017. We've been working with humanitarian relief since the war broke out on the 15th of April. So SAMA's strategy in delivering the aid for the people in need in Sudan has been mainly focusing on adopting the localization of aid. And what do we mean by localization of aid is leveraging donations worldwide to support located organizations and initiatives on the ground to provide the needed aid to the communities. So we don't work by ourselves to deliver the aid. One way around it is we collaborate with people on the ground, with the communities themselves, so as to serve the people on the communities. We find this way more effective in delivering our actions, and even it has less strain on our own fundraising strategy. So since the war broke out, we worked in 5 states: Khartoum, Jazeera, White Nile, River Nile, and Hogness State. We've supported more than 6,000 internally displaced people in Sudan with various services, including shelter, food, and health services. We provided more than 900 children with medical care, and we performed more than 500 surgeries, various types of surgeries, including trauma, obstetric surgeries. So this map highlights our work in Sudan, different states with different focus areas. For example, Khartoum state, we've worked with the children, supporting cancer patients, trauma, and maternal health. And in Dongola, we've worked in delivering healthcare services to the internally displaced people and also supporting women's health. In Jazeera, we've worked with supporting feeding of internally displaced children and also IDP sheltering and feeding. So as you see, we worked in quite large scale geographically and with delivering various types of services. So the project that we're active now and we really want your support in is feeding displaced in the White Nile State. So the White Nile State in Sudan, according to the United Nations, received more than 500,000 internally displaced people, which is a large number, and the situation there has been very dire. Regarding the health situation, it's really alarming. More than 1,200 children in the White Nile State contracted disease due to an outbreak since May. So the displaced women and children in the White Nile State are suffering severe scarcity and disruption of food supplies, and this has become our focus recently. So this is a mother with her 2 children and her sister behind. They are really suffering. This is a hungry child in the White Nile State. So Sam has been working for more than 6 months to secure daily meals for those in need. And to date, we served more than 67,000 meals to those people. So this aid has been delivered to the people in need, people in the camps in the White Nile. And as part of our localization, those people, the IDPs, are cooking the meals themselves. We just deliver them the raw food items, and we let them collaborate with each other so as to create some sort of community, so as to create some sort of sense of ownership of this aid. So we are trying as much as we can to make this. I know it's very hard, it's very difficult, but we are trying as much as we can to make it a enjoyable experience for themselves. So thank you very much for everything, and thank you again, Mr. Peter, for this opportunity.
Sorry, forgot to unmute myself. Thanks very much, Mohammed. And I hope everyone listening will be able to join us in Manhattan on January 7th for an in-person event in support of Sama's work within Sudan. And then we'll have to, again, connect with Mohammed and have a chance to hear a little more, as well as some personal testimonies from some of the displaced people within Sudan who've been very relieved in the midst of all what they're going through, to have the support that they have, in places like where Sama is supporting folks at White Nile State, as well as all the other areas that he mentioned. I think for folks in that often that desperate of a situation, to have that kind of a lifeline makes more difference than we can know. If people are able to contribute now, there's a GoFundMe page. If you just look for, GoFundMe, feed the people in Sudan's for our forgotten war. You'll probably pop it up, or just find me on Facebook or Instagram, Peter Hogness, Hogness, and I can connect you as well as provide the details on the event on January 7th. Thanks again.